Hello everyone, I'm Dr. Nitin Ghag, consultant plastic, reconstruction and cosmetic surgeon. Today I'm going to talk about dressing material. More than dressing material, I'm going to talk about doing dressings, especially a patient can do dressings by himself at home or his relative can do dressings at home. A small or medium-sized dressing can be done at home only after the discussion with your surgeon and he is okay with it and he allows you to do dressings at home. And all these materials are easily available, which is required for the dressings are easily available in the market. So basic things which I'll show you in this video. One is what you require for the basic thing for the dressing is you require a gauze piece. Now this gauze piece is available as a big than, a big chunk of piece of the gauze piece cloth which is already available in the market. You can take this. Mind you, this is not a sterile one. This gauze piece you have to cut it into small pieces, which you can with the normal scissors you can cut it off and make it into a small piece of gauze piece. Now these are all unsterile gauze piece. You also get the ready-made sterile gauze piece in the market. It's a small packet which contains around 2 or 3 gauze pieces and which can be directly used for the dressing. Or if you don't get that, you can make this sterile. This can be made sterile by steaming it in a pressure cooker. You can just take a bowl just an empty bowl and cut these gauze pieces into these kind of small pieces and you put these gauze pieces into this bowl without any water and then take a pressure cooker, just put little water around this bowl in the pressure cooker and put this bowl in the center and put the lid of the pressure cooker and the whistle and let it whistle for at least 3 to 4 times. So and allow it to cool down. So this whole thing will get steam sterilized, this gauze pieces will get steam sterilized and after that you can open the lid and use this sterile gauze pieces for dressings. Then other thing what you require is saline. This is also which is easily available. You either get a 500 ml bottle of saline or a 100 ml bottle of saline. 100 ml becomes more economical because you can easily open it and use it for 1-2 dressing and you can throw this off. This you have to keep it open, so little cumbersome to use this, but I generally prefer the small 100 ml bottle of saline. Then as per your surgeon what type of dressing, there are different types. I generally advise saline dressing. Sometimes I advise the wound looks not that good, a little infected or there's some kind of a dead tissue or slough, so you require some antiseptic solution. So I can ask them to use either betadine or that is the povidone iodine, which is also available as a solution in the market. Then we can use a de-sloughing agent to remove those dead tissues. You have to have some hydrogen peroxide, which is also available, or sometimes I tell them to use a U-Sol, which is the Edinburgh University solution of lime. So these are the few antiseptic solution and de-sloughing agents which are generally used through cleaning of the wound and doing the dressings of the wound. Then another dressings which sometimes we ask the patient to use these tules. Tules are nothing but this is an antiseptic meshed material which is kind of placed on top of the wound so that it doesn't, one is the antiseptic ingredient gets released in the wound as plus the gauze pieces doesn't stick to it. So this is one of the rectangular in a square shape. And this is kind of a mesh thing which you can see it's a little oily and sticky, and because there is the antiseptic cream or antiseptic ointment applied to this mesh. So this is a chlorhexidine tule what is called, which can be also used for the dressing to put on top of the wound. So coming to how do you begin doing a dressing. So first and foremost all this thing, yes, after your surgeon has advised you to do dressings and at home, you can do this dressing. So please first consult your surgeon regarding the dressing, ask them what type of dressing he wants, and then if he is okay to you to do dressings at home, then you can do dressings. So one is first thing, if an attendant is doing the dressings for a patient, so yes, you have to have clean hands. So one thing, you properly wash your hands with soap and water on the running tap. You take a nice soap or any antiseptic solution, soapy solution, nicely clean your hands, completely dry with a nice clean towel, and then you can also take this sanitizers, which can solution, which is now readily available. You can take it and you can make your hand sterile, so with infection free. Once you have done this, then you can use your hand to take this gauze pieces, the sterile gauze pieces, and all the other solutions which is added to it to do the dressing. Or the other thing is, you can get these gloves which is available in the market. You can take these gloves. These also are, this is not a sterile one again. These are the unsterile gloves. You get the sterile packets of gloves which is like, the various sizes. You can take those gloves also and do the dressings. So, but in case if those gloves are not available for you easily, and so you can just cleanly, nicely wash your hand with soap and water, and then of course we sanitize with the sanitizer, and then you can use your hand for doing the dressings. So yes, before we start the dressing, we will first the type of dressing. So first I will try to show you the simpler one, that is the saline dressing. I generally advise saline dressings, and generally more the frequently you do the dressing, more healing is much faster. So that's what I follow, and the more wet dressing you do, it is more better for healing. So coming to the saline dressings, you take a bowl after you clean your hand and everything. You take a bowl which is kept in the pressure cooker with this gauze pieces. So this bowl is also sterile because of the steam sterilization. You take this bowl, then you take this saline, which is actually a 100 ml bottle. You can take this, you pour the saline into this. Okay, after you pour the saline, or you ask somebody, that will be better because your hands are clean. You ask somebody to pour the saline. You take these gauze pieces, one of the gauze pieces which is sterile, and you can dip it in it. Once you dip it in this saline, you lightly squeeze it. Not completely squeezing hard, but lightly squeeze it so the excess water comes off. And this wet gauze piece you can directly apply over a wound. Say in case if there is a wound here in the hand, I apply the whole gauze piece, directly this wet gauze piece on top of the wound completely. Just apply this before, and then you take this dry gauze piece and you put a dry gauze piece on top of the wound, and you can either take a bandage, which you get 4 inches bandage, which can be wrapped around this to keep the dressing in place, or you can take this micro tapes, sticking tapes, and you can keep it in position. So this is and this is done more frequently. So you properly cover it with the dry gauze so that the wet thing is not exposed, and so that you can put tapes or you can put a bandage around it. This generally, preferably if you do many times, like for example twice a day, thrice a day, it is much better, because what happens is the more frequently you do the dressing. So when the next dressing I do, say if I do the dressing in the morning and the next dressing I do it in the afternoon, I remove this thing. When I remove this, all the infected material, all of the organism sticks to this gauze pieces, and then you throw it off directly. So this infected part goes off. So as you frequently change, and then again you take a new gauze pieces, again you little bit clean with saline and make the other gauze piece wet, squeeze it, put it again, and put a dry gauze piece, and again tape it up. So this is how you do saline dressings. Now in my next video, I'll be talking about how to do dressings in an infected or mildly infected wounds, that is with betadine or with medicated Tulase. And so that will be there, I'm covering up in the next video. And if you have any comment, or if you have any suggestion, or you need any information, be feel to contact us, so you can write in the comment box. And thanks for watching.